Now, for patients with the most advanced heart failure, LVADs, left ventricular assist devices, are a lifeline. The Elevate registry gave us some real-world data on the HeartMate 3.
Right. The HM3 is one of the main continuous flow LVADs used long-term. Elevate tracked 463 patients who got one in regular practice.
What did the long-term outcomes look like? Survival? Stroke?
Pretty encouraging, actually. The 5-year overall survival was 63.3%, and stroke-free survival at 5 years was 58.1%.
Okay, so decent long-term survival. What about quality of life? That's huge for these patients.
Absolutely. And the registry showed substantial and, importantly, sustained improvements in functional capacity and quality of life over those 5 years.
That's really significant, isn't it? Suggests that modern LVADs aren't just buying time, they're buying quality time for many end-stage patients.
That's a fair assessment. Good long-term survival with an acceptable stroke rate and meaningful QL improvements. It's a vital therapy.
Sticking with LVADs, managing anticoagulation and antiplatelets is always tricky. Bleeding versus clotting. The ARIES HM3 trial asked a specific question about aspirin.
Yeah, specifically in HeartMate 3 patients already on a vitamin K antagonist like warfarin, do they also need aspirin? So over 600 patients were randomized. Either stay on aspirin or switch to a placebo.
And the primary endpoint, they were looking for non-inferiority of not giving aspirin, right? In terms of major adverse events.
Exactly. Survival free of major non-surgical hemocompatibility events, things like stroke, pump thrombosis, major bleeding at 12 months.
And did placebo prove non-inferior?
Yes, it did. In fact, the event-free survival was actually numerically higher in the placebo group, 74% versus 68% in the aspirin group. The stats confirmed non-inferiority.
So the key takeaway is you can likely skip the aspirin in HM3 patients on warfarin.
It strongly suggests that. Avoiding aspirin seems to reduce bleeding complications without increasing the risk of thromboembolic events like stroke or pump thrombosis. That's a pretty major finding for simplifying management and potentially improving long-term outcomes.
Huge practical implications.